So now let's move on to the next research. I would like to introduce you to the next research, which is about accuracy of neutrophil to lymphocyte ratio for predicting the ruptured appendicitis patients in Uttaradit Hospital from Ms. Nawinda Musikpodok.
Good morning, ladies and gentlemen. My name is Nawinda Musikpodok from Faculty Medicine, Sirindhorn University, and I'm pleased to be here today to talk to you about accuracy of neutrophil to lymphocyte ratio for predicting the ruptured appendicitis patients in Uttaradit Hospital. The most severe complication of acute appendicitis is ruptured appendicitis, and the incidence is 2.9 per 10,000 people. Although diagnosis score for acute appendicitis are being developed, such as the Uttaradit score. Nowadays, ultrasound and CT scan have role, but they are costly, limited in some hospitals, and require resident specialists. And the time which delay diagnosis is one of the risks of ruptured appendicitis. As a result, many studies have been investigated the relationship between ruptured appendicitis and inflammatory markers, such as white blood cell count, C-reactive protein, or neutrophil to lymphocyte ratio. And when compared to other inflammatory markers, the neutrophil to lymphocyte ratio was a reliable predictor of inflammatory response and was highly accurate in predicting appendicitis. As a result, to reduce about factors that interfere with blood cells, such as patients who have cancer, immunodeficiency patients, the study analyzed the relationship between ruptured appendicitis and the neutrophil to lymphocyte ratio in people aged 15 to 60 years who had no underlying disease. In order to investigate the accuracy of NLR in predicting ruptured appendicitis in patients Uttaradit Hospital, to determine the cutoff value of NLR in predicting ruptured appendicitis patients in Uttaradit Hospital. And this is a accurate relation equation in this research. So, study design is retrospective, cross-sectional case is ruptured appendicitis, and control is uncomplicated appendicitis. And we study in patients aged 15 to 60 years who had an appendectomy between 3rd November 2019 to 3rd November 2021 in Uttaradit Hospital is 625 patients. And then they were excluded by these criteria as shown in this pink frame, such as patients who taking immunosuppressive drug, patient with incomplete laboratory data, or patient who is pregnant. So the total number of appendectomy patients was passed after exclusion criteria is 328 patients. And then divided into two groups that are 273 uncomplicated appendicitis and 55 ruptured appendicitis patients. General characteristic and laboratory blood result of the two group patients, it was discovered that the majority of the difference between the two groups that statistically significant with p-value less than 0.05 were 8. Body temperature, the duration of onset abdominal pain to hospital, mean of neutrophil, mean of lymphocyte, and neutrophil to lymphocyte ratio 8.8. So the analysis of the cutoff value was found NLR received the appropriate cutoff for value as follows. The NLR 7.1, 8.6, 8.8, and 13.5. Determine the area under the ROC curve or AUC for the most appropriate cutoff value. We found the NLR 7.1 had the highest sensitivity and 66% 7.3, the moderate specificity 60.4, and AUC 0.64. And this is a picture show different AUC from the different NLR, and the blue line is the NLR 7.1. And the last one, a logistic multiple regression analysis of the NLR cutoff value with clinically significant and significantly different factors such as age, body temperature, the duration of onset abdominal pain to hospital. And it found that NLR increased the predictive potential of ruptured appendicitis by 3.19, and p-value is 0.002. As shown in this picture, by the red line using only the NLR 7.1, and the blue line is using NLR 7.1 with significant factor. You can see the different AUC and the AUC clearly increasing from the 0.64 to the 0.82. From study found NLR 7.1 was the most appropriate for predicting ruptured appendicitis due to the highest sensitivity with a moderate specificity, and AUC increased. So our study found the NLR 7.1 was statistically significant to predicting, but is not accurate enough to predicting ruptured appendicitis alone. In order to improve accuracy, the prediction should be combined with other factors that influence incidence of ruptured appendicitis. And in the research, know about the NLR can be used as a screening tool for predict to differentiate between ruptured appendicitis and uncomplicated appendicitis. Thank you for your attention.
Thank you so much for the presentation. Now we're proceeding to the question and answer sessions.
So how did you get the neutrophil and lymphocyte numbers? So whether from the machines or manually, differential?
I choose the neutrophil to lymphocyte ratio from the complete blood cell count in patient admit in hospital, in the first admit.
Okay. And did you check the reliability of the interpretations?
Yes.
Does it correlate well with the smear, the blood smear?
And in this research, I shoot about people who is not interfere factors. I exclude about patients who has cancer, immunodeficiency, or who take a medical that interfere with blood cell. So I think my research can be absolutely to query about neutrophil to lymphocyte ratio that is not have interfere factors.
น้องนวินดาสวัสดีครับ very good research. I think your research idea is very useful for the hospital taking care of multiple patients at one time. But to put further, I think you have to interpret the significant. Statistically significant is not always be clinical significant. What do you think about? Do you have any comment about the ROCA under the curve area of about only 0.6 to 0.7? Do you think it is good enough? If not, what do you think the true benefit of using NLR for the patient to rule in or to rule out, in your opinion?
I think my research study about NLR, right? And NLR can be predict only NLR can predict ruptured appendicitis. But if patient have a clinical sign and symptom or physical examination have shown that patient have ruptured appendicitis, it is more evident that can accurate for predict ruptured appendicitis. And I think it's accurate enough because I think NLR can be ruled in patient who is ruptured appendicitis, and from the primary care center can please take time with patients for referring about patient from the primary care center to medical care center, because some primary care center are located distant from the medical care center, because ruptured appendicitis is emergency condition for surgery.
Thank you. But let's think further. I think the negative predictive value is very high, 90%, but positive predictive value is only 25. Let's think rule in or rule out again. Okay, your homework.
Thank you for education.
So thank you so much again for the presentation. Now we're having a time for the judges to score.